Hello. I'm so happy that you guys are here. We are going to do a very short tutorial today. We are going to go over your Breathe 4.0 protocols and the practicality of the things that you need to have. When you get your Breathe 4.0, you'll be able to look at all the topics that we can cover and choose exactly what you want to work on. And then from there, we will be able to customize exactly what your type of patient needs or what you need as a patient for you or for your children. So the first step is to get your book and read it. And you don't have to read the whole thing, but all the theory and the practical recommendations are here. Today, we're not going to do the appointment charting, but next week, if you join us, we are happy to invite you, and we are going to go through the 4 appointments that we do with our system. Our system is designed to teach how to close the mouth at rest, have to have a fully closed mouth at rest without any effort, without conscious effort. By using the Uplock system, you'll be able to make the position automatic to learn to have your mouth closed without any conscious effort. And that's critical for recovery at night, for recovery after sports. So you will learn all that in the book. Once you have your book, you'll be able to understand exactly what you need as a patient or as a therapist, as a clinician. We are going to show you what we have and how we do our protocols. We have the 4 appointment protocol. We're not going to go over that today, but next week when you join us for the tutorial, we'll be able to show you that, and then we'll have sessions with questions and answers, Q&As. So for you to start with the system, the first thing you need is your up locker. When you have your up locker, you'll be able to notice the system that gives you feedback if your mouth is fully closed, if you have negative pressure suction inside your mouth. So the way we recommend this is on appointment 1, we give the patient their up locker. And we're starting to give the patient their up locker with the deglutition kit. And that is this tube that comes with the deglutition kit. So the patient will take this device and a syringe home for the first appointment. For the first appointment, we'll ask either the parent or the patient to wear this about 20 minutes every night and make sure that they're comfortable, they can breathe through their nose, and they're keeping the bubble in. We like to send this home because from day 1, we can start utilizing the connectors. And when we connect this tube, we can take the funnel out of our device and connect it in the tube. Once we have it connected in the tube, and always make sure you have no leakage of air. So the tube is designed so you can connect it and you can be separated from the patient. So if you have a child, you can have the child wear this, and the parent or the supervisor can hold this in the hand, and we can notice if the pressure, the negative suction is working or not. So having this distance 3-4 feet away from the patient is ideal so that the supervisor doesn't have to be that close to the patient, and each one of them can be doing whatever they want to do, watching the computer, watching their own thing, but having the feedback here will allow you to either turn the TV on or off based on the suction in the mouth. When the suction is in, we know that our tongue is in the roof of our mouth. There's no air inside the mouth. So the instruction is you take all the air out of your mouth and you have a very relaxed musculature, very relaxed face. So this is ideal for the patient to work with for 20 minutes every day. If a patient can work with this for 20 minutes, it will start the pathway so that naturally the mouth will go there. So if we swallow right now, our tongue will go to the roof of the mouth, and then our brain will learn to do this at rest. And this will tell us if we're doing it or not. Feedback is the key to meaningful practice, and meaningful practice is the key to really changing the trajectory of growth, of breathing, of health. Okay? So this is a great system, and this comes on your deglutition kit with these tubes. It's very interesting that we call it the deglutition kit because the up lock will follow deglutition. When you swallow and you end your swallow, you can recognize the pressure. So it's very good to have this at home, and we can take a little bit of water. We just have a glass of ice water here, and we put it in our syringe, and we connect it here. We can use hibiscus tea, something colorful, anything we want. So then we are going to be able to practice swallow, and we can do 1, 2, 3 milliliters and just hold it in the dunder space and then swallow without using our face. A lot of children swallow making faces, even adults. We have dysfunction, so we want to learn to swallow invisibly with a quiet mouth. So we can practice 1, 2, 3 syringes with a very quiet mouth. And this is ideal to do on our first appointment. So we give this out to the patient and they come back at 7 days. We don't talk about pressure, we just talk about this. When the patient comes in, the next appointment, and that would be after 7 days, that's when we give them more stuff. We do have a lot of different tools that you will be able to customize for your special needs. That is a very basic kit that we want everybody to have. Honestly, anybody that gets an up locker should get a deglutition kit to go with it so that the training and the practice with it is meaningful and it's successful because it's something gentle and it's very welcoming. The system's very welcoming. It tells you what to do. And mothers like me who struggle with their kids in front of the TV with the mouth open, watching TV, and we go, close your mouth, we just lose a lot of the relationship with our children. This system allows parents to monitor and continue that trajectory towards a closed mouth and better growth and better breathing so that the children don't have to struggle with the nagging of close your mouth. They simply know the mom holds it in her hand and she keeps the remote, turns TV on and off. There is no nagging, no conversation. There's only meaningful practice. When we're able to practice properly, we can practice short amounts of time very successfully. So that's what we consider meaningful practice. So this is the first, let's say, basic kit. Our patient comes back at 7 weeks and we make sure that their gums are not bleeding, that they're able to hold it, that their nose is working. We do a little bit of nasometer measurements, make sure they're comfortable. Second appointment, we will give patients, depending on what your protocols are in your practice, we like to give the patients a lip locker, and we also do in-office measurement. So when we do in-office measurement, we have our in-office appliance, which is this one here. So we have one per patient. So the patient has their own device, which we keep on our mesh bag. This is our mesh bag, and we have one per patient. It's always cleaned for them and kept in an aerated place. So we like for them to bring their up locker, but if they don't, we always have an in measuring kit. And when we're done with it, we put it close sterile, and we always clean it well with our syringe in the office or whatever you have at home. So this is our in-office kit. When they come back after 7 days, you are going to spot check the pressure because we want the pressure to always be consistent. We don't want too much, we don't want too little. Too little, the tongue will fall down. Too much will start causing problems with the teeth, the gums, and it's unsustainable to do too much pressure. So depending on the type of patient, you can give them their device. When we use our in-office manometer, we put our saliva trap, and each patient has their own saliva trap. These are the saliva traps. We have these. So this will keep your manometer from cross-contaminating. So we have a tube. This tube can be the same for all the patients, their connector to the manometer, but each patient has their own individualized saliva trap, also can be rinsed and kept in their mesh bag. So this is our individualized system. If you want to use the regular up locker, you can use the tubing that comes in the measuring kit. This is the measuring tubing for the manometer. And you can put this one in the saliva trap right here. So we have a connector that is much shorter. And this one connects to our saliva trap. Let's open up our saliva trap for you. This is our saliva trap, individualized per patient, and the patient can have their own measuring tube. This part here will go in here. And it will connect into the saliva trap. What I do is I move it back, kind of like a turtleneck, and that helps me connect it here. So we connect it, and it's critical that this is very, very tight. Okay, very important that we cover our saliva trap very well, and each part is well put together so that there is no leakage of air. And this is well designed, so there's not a lot of leakage. If we just push it in, it should be fine. So this is the shorter connector adapter when you are going to use this tube. So you can use the one in office that has a longer tube, and it connects here. Or you can use the longer tube and your traditional up locker. So this is the one we use mostly in the office, but this one can be used at home. A lot of patients take their manometers, loaners at home. So first appointment, 7 days, everything's fine. They come back, we are going to do their first pressure spot check. And for that, we are going to use our manometer. You can always zero the manometer. We zero the manometer for your altitude, and we make sure that is in millibars. Then we are going to connect it on the left side, and we are going to use this one into our up locker here. And I'm going to very quickly show you how we do it. Okay, so that was a little sample of how we get our manometer to get to between 15 to 10, 10 to 15, anywhere under 20 is good enough for our spot check. We do that for 30 seconds, and I will show you how we put it in our appointment data sheets. But we do a spot check for 30 seconds, 1 minute, and if they can hold it there, we are happy. They can go home with their manometer, and the instruction would be to practice spot check for a couple minutes, and then practice 20 minutes with the up locker. So they can take their own up locker with their tubing, which is this one, and their manometer that they can either buy or have a loaner. So this goes in here again, and it should work very well for our patient. So this is the in-house and this is at home. So we have both of them. You can order them from Florida. We also have the bags of saliva traps because you want every patient to have their own saliva trap. When they are done using their kit from home, you pull it apart, you run it through the water, you can take the saliva trap out too. You can put it in cold sterile. Not really necessary because you will only use it for the one patient. And also this doesn't go in the body. It just saliva might go out. So this too will have some saliva in it. You can see a little bit of it. So we got to make sure that we rinse it well, and then we'll take a air, either compressed air or air syringe in the office. We will dry it very well. Once it's dry, the patient can take it home, their saliva trap. Their connector doesn't need to be removed. Their connector can stay in the manometer. You can clean it if you want to wipe it, but this never gets contaminated with saliva. So when they're ready to practice, they just need to connect their saliva trap and their K10. And each patient will have their tubings that go in here, and they will have their up locker to go home. And what we really like with the kids is to always have their syringe so that they can practice. Another way to do it is you can take this part of the tubing and put it directly in a glass. Kids love to do this, although they love to handle the syringe and be in control of the syringe. So this we do a lot with our elderly patients that are losing the reflex of swallow, or with the patients that have worn a feeding tube and they need to be rehabilitated. You might have patients like that. So this is a great system for that. So this part here, they can also clean it, dry it very well. And once it's dry, we can put it in our mesh bag for our patient. We have these toys that you can get for orthodontics, or you can make your own. And these come with their tubing also, and you can customize some of these for your patient. And we can plug them in here. Remember, you can always measure the dunders or the Frankel. I'm a fan of the dunders, but younger kids might do better with the Frankel. So you will find all that explained in our Breathe 4.0 book. Little kids love doing this. They can choose their toys in the office and they go home and we know they can watch TV or listen to a story if the belly of the panda bear is in or whatever toy they choose. So this they also get and they can also clean it well, keep it in their mesh bag, either in the office or to take home. We also give out the lip locker. This is more for our adult patients or our athletes. They love the lip lockers, and we have packages that have 12 lip lockers. So you have one for every month. This can be washed, but they're good to have around the house, around the gym, if you're going on a bicycle ride, if you're driving in the car, and you're just going to be listening to a podcast or the radio, you can work on practicing the up lock. And the way this works, you put it on, it has some safety straps. You could remove them if you don't want to, but the safety straps stay outside the mouth. Then this part here goes over the front teeth. You don't bite this. So this is just for safety. So when I put it in, you'll see that I can slide it. That's how you check that you're not biting at you or your patient or your child. You put it over the teeth, and this helps you hold on, maintain that suction. And you can sleep all night with this, or you can just practice for long periods. Okay. So the lip locker helps you also maintain that up lock position. Wash it well, soap and water, and you put it in your mesh bag. So you have all your stuff here, clean, dry, and you can use it to continue to automize the up lock position. And having some kind of suction cup is very useful to demonstrate how strong the up lock can be. If we can hold a cup of water or tea or coffee that's heavy, this means we can hold our tongue. Our tongue can be 250 grams. So we want to make sure that we understand what we're trying to achieve. Of course, if your nose is not working, you will not be able to sustain the up lock. So we have our nasometer to measure, and ideally with the up locker, with the lip locker, or with our baby pacifiers, you can measure a baby. The most ideal way to measure a child or a baby is when they're asleep. You give them the up lock pacifier. A little small for me. And you can measure the pressure for the nose to make sure that the epipharyngeal space is not needing a lot of higher pressures to get the air in. If the pressure is very high, the negative pressure is high, then we have to consult our ENT. And these numbers, this gives us the ability to communicate very efficiently with our transdisciplinary team. I'm excited. Please join me next week. We are going to have these sessions. We can always have our guests. We're going to take some questions now from our students and doctors, clinicians, parents that are in the session. And we will continue to have sessions for question and answers to get you to be able to use the system to optimize your breathing. Remember, it's not about nasal breathing only. It's about optimizing your breathing for each activity. Sometimes we need to mouth breathe, sometimes we need to nose breathe. But when we're recovering, when we are sleeping, when we have finished exerting physical activity, we want to have that nose breathing and we want to be very efficient with it. For that, the up lock system, it's the best tool you can ever find. join us in these very practical sessions. Next week, we're going to have the data sheets. And remember, with Forwardonics, you can grow, feel, look, and breathe better.